So what is hypopressives and how does it work? So hypopressives is a breath work and movement practice that rehabilitates the pelvic floor and the core. And it's amazing for prolapse, diastasis recti, incontinence, low tone pelvic floor, high tone pelvic floor, better pressure management, which helps with preventing hernias. And it's really calming for the nervous system as well. So how does the practice work? So it works in a number of different ways. So we are focusing on better breathing function. So we are working on lateral breathing, so that's 360 breathing all the way around the ribs, which spreads the pressure when we breathe around the whole system, rather than just breathing into the chest or breathing into the belly, which isn't managing that pressure as effectively. It also means that the diaphragm muscle will work more in its full range. And if that muscle is working more functionally, it will be impacting the pelvic floor as well. So we'll get this nice synergistic movement between the breathing diaphragm and the pelvic diaphragm, and they'll work nice and synergistically together. We also focus on posture. So we work on optimal postural alignment. So we have neutral pelvis, ribs stacked on top, shoulders on top of that, head on top of that. Not only so that those two diaphragms can work synergistically together, but to improve our posture so that we are improving our pressure management. We also have postural principles in hypopressives. So you'll see a lot of ankle dorsiflexion. Studies have shown that ankle dorsiflexion increases the activation of the pelvic floor and the transverse abdominis. We also work with different arm positions, which is increasing the strength of the shoulder girdle, increasing the activation of the serratus anterior and that ability for the ribs to expand and manage pressure. We also work with that all-important vacuum, that apnea breath. So that is a breath hold with a rib stretch, which creates a vacuum that lifts the pelvic viscera, so lifting the pelvic organs, contracting the pelvic floor and the transverse abdominis. We increase the pressure in the thoracic and decrease the pressure in the abdominal and pelvic cavities, which is why the practice is so amazing for prolapse and pelvic floor dysfunction. We are also calming the nervous system, so we're bringing ourselves more into our parasympathetic nervous system, stimulating the vagus nerve. We know how important our nervous system is for our pelvic health. So there's a little bit about the practice. I hope you found that helpful. Do drop in the comments and let me know if you have any questions. There's also some more information about how you can work with me in the description below. I will be bringing you lots of videos about how hypopressives works, how you can learn it, and how you can keep up with your practice. So do stay tuned for more, and thank you for watching.